Hi, Venus. Hope you're doing good. This is Dr. Shree from Team MDS CONQUER. I was off for the last couple of days, not feeling well, but a little okay now. So I have a few updates from my side which I need to discuss with you. And this video is exclusively for the students who are planning to prepare or planning to give NEET MDS 2026. It includes all categories of students, whether you're halfway into the prep, whether you're done with the preparation, planning to go ahead with the revision, or whether you want to start the preparation fresh now. So all category of students are included in this part. First and foremost thing about the date of examination. Date of examination is definitely going to be unpredictable this year. Because normally exams in the last couple of years are happening in the month of March to April. The next year. I mean, maybe if you just compare the dates can be from March to April 2026. But anything can happen because there is lots of drift in the dates compared to the NEET PG, that is for the MBBS people, when compared to the NEET MDS for the BDS people. But considering the COVID, because there were like interns batches where the COVID was started when they were in the first year and the admissions were a little late and the internships are still ongoing. Okay, so considering all these things, it may be little unpredictable this year compared to last year or before last year. But assuming that it will be in the month of March and you have to focus on preparing for it. Okay, so let's assume in the month of March and start your preparation in such a way. So if you just assume in the month of March, you're left over 15 days of October, November is going to carry 30 days, December is going to carry 30 days, Jan is going to carry 30 days, and February I'll be giving 30 days. I'm not counting March, the days, or if it is April, I'm not counting the March as of now. So roughly you're going to have 1, 2, 3, 4, 120 plus 15, 135 days plus preparation time is there. It can be more than that. Exam is unpredictable. But make sure you have to plan your revision plus reading in such a way that it has to be done within 135 days. The extra days in the March, if the exam is in the March, the extra days if the exam is in the April, March plus April, the extra days if the exam is postponed are just useful for your revision because unpredictability is there. And that too, I'm addressing this as an important thing that interns has to make it. There are still a few states of interns still ongoing with their internship. Of course, Karnataka are done with internship. Andhra will take 2 more months. And of course, Maharashtra and Telangana will take 4 to 5 more months of internship is still left over. So you need to plan your preparation in such a way. If you are starting fresh now, there should be at least 100 plus 30 days of revision. So if you're starting now, you should keep 30 days of revision solidly. Minimum 30 days of revision is mandatory if you're starting your preparation. On average, like I regularly go with 25% of time should be there for revision. If 100 days are left over, 75 days should be your reading and 25 days should be your revision. So considering this 135, I'll keep 30 days for revision. So 105 days for the regular reading and 30 days for your revision. It is a mandatory thing. Whenever you have that extra part, like for example, like I regularly divide the subjects into multi-layers. Like for example, layer 1, I'll be focusing more on PYQs and PYQ concepts. So I'll be doing PYQs and PYQ concepts in the layer 1. That too, last 10 years. I'll be focusing more on the last 10 years PYQs. That is layer 1. So even if you do this layer 1 properly, with proper revision, you can easily end up with a good rank. So this PYQ concepts plus layer 1 revision can be done within 3 months. If you are decently a good student at a BDS level. If you get a chance, if you have a chance of little bit of more inclination, I'm telling like 3 months in the sense like 90 days, each of 10 hours, a minimum of 10 hours of preparation time. Okay. So that is 900 hours of preparation time will be sufficient to do this layer 1 with a proper revision and analysis with the mock examinations, and you will be rectifying your mistakes, time management, everything can be done with 900 hours of preparation time. This is for dentistry, not for NEET PG. For MBBS students, it will be different. Strategy is different for us, different for them. Okay, so don't compare the strategies here and there. If you get a little more time, for example, I'm talking about 135 days, each of 10 hours, that turns around like 1350 hours. You can do a little bit of layer 2. Layer 2 is basically you're trying to connect the concepts. Now here, layer 1, what I'm doing a PYQ here, and I'm doing a PYQ concept here. I'm doing a PYQ, I'm doing a PYQ concept here. I'm doing a PYQ, I'm doing a PYQ concept here. And all these PYQs can be from a same topic. That is the same chapter. In a simple words, it can be from a same chapter. For example, I'm talking about composites. So this PYQ concept is talking about the composition of composite. This PYQ concept is talking about the filler classification. This PYQ concept is talking about the lasers or the lights that are useful for the curing. Or there is one more concept that is talking about the C factor concept, how it is affecting the polymerization shrinkage. So this is about the layer 1 preparation. Whenever you get a little bit more time, a month more time. So what you have to do is you have to connect these concepts. Concepts has to be connected. I'm trying to connect the concepts so that you will have a confidence over the topic whatever you're reading. Normally, if someone is doing PYQs and PYQ concepts, you may not feel so confident. Even if you don't feel confident, you will get a rank. Because that's the methodology of reading. That's the methodology of reading. Because we apply the same methodology when we are preparing for theory-based exam also. We are reading question by question. We are not reading the entire chapter. Sometimes when you have a time, you are going to have a connectivity that is regularly done in layer 2. So it's better you move around PYQs and PYQ concepts with a little bit of connectivity that is more than sufficient to end up with a decent rank. I'm not telling about a great rank, I'm telling about a decent rank, because I'm talking about a student who is about to start the prep. You have a reservation. Reservation is going to save you. If you have a category and if your state has a little bit of less competition in the state pool, or you have some sort of service quota or something, that is going to be helpful for you to end up with a good rank, even if you start your preparation now, considering 135 days only. I'm not talking about the postponement of exam. I'm not talking about the unpredictability when the exam is going to get conducted, what is going to be the consequence. I'm not talking about all those things. I'm talking about just 135 days, splitting them into 100 days for first reading and 30 to 35 days for the second reading. If you plan your preparation in such a way, so that is more than sufficient, but try to focus more on the PYQs and PYQ concepts from the app or from the website, wherever you are getting access, wherever you are taking the coaching. Or if you are preparing myself, even also, that is also fine. But make sure you should have a proper source to read the concepts, understand the concepts, clear the doubts. It's very simple. Okay. Now the next point to be noted is doing PYQs and PYQ concepts perfectly from a proper source is very, very important. Normally in MDS CONQUER, because we have a group of teachers who are going to take the maximum subjects, and we try to teach in the integrated way. So my recommendation for all the MDS CONQUER students, it varies from institute to institute. So if I'm talking about PYQs and PYQ concepts, I want you to do, for example, you are a pro-life student. My first recommendation to go with this PYQs and PYQ concepts is your pro-life papers. We are done with around 60 discussions as of now, and we'll be having 40 more. That turns around like 100 plus discussions. That is one good source of doing all the pre-PYQs with the proper concepts and interlinking integration way. The second one is the bootcamp series of 2025. You have already a folder, access is already given, and similar bootcamp series will be done for 2026 once the dates are out. So these three are going to be good source. And the fourth one, what I personally recommend is T&D. Because pro-life and offline students are having this T&D. Means after every grand examination, they are having entire paper discussion with them. So most of the questions in the grand exams are integrated questions or questions which are taken from the old papers, old concepts, both the medical as well as dental. It's an open secret, nothing to hide here. So whenever you are attending such discussions, you will get to know how to solve a particular question which is given in a particular examination. Methodology of solving or approach of solving is very, very important. So these are the mandatory things I recommend you to do first when you open a particular subject. For example, tomorrow, if you are planning to start your oral path plus oral medicine, and you feel like you don't have a proper time, like a regular time of 13 or 14 hours that a aspirant is going to sit, you have hardly 5 or 6 hours, you're a housewife or a mother, just restarted the preparation, you have internship to manage on the other side, you have multiple tasks to manage on the other side, you're working in a clinic, you have your own clinic, but you want to give examination. My recommendation is start with the prolog. That too for a dental subject. This is a dental subject because oral path and oral medicine concepts most of us are aware. For example, you are taking a subject like biochemistry. I don't recommend you to start straightly with the prolog. If a subject like general surgery, I don't recommend you to start with prolog. OS, yes, dental subject I'll start you to recommend with prolog. Physiology, medicine, general surgery, general medicine, pharmacology, all these things I want you to start with smart videos plus your worksheets. If you have time, if you don't have time, you have to start with this because basics are required for those subjects. For example, first year subject, general anatomy, I want you to start with smart videos and worksheets. Biochemistry, same. Physiology, same. Maybe dental anatomy, dental histology, even then I recommend you to go with the same methodology. TM, you can straight away start watching the prolog. Pharmacology, same. Pharma, I want you to start with the smart videos. DM, I'm keeping as an exception. Next I'm talking about the 7th subject, microbiology. You can straight away start with prolog classes. General path, straight away you can start with the prolog classes. General medicine, smart videos, you have to start with smart videos. General surgery, smart videos. Oral path, prolog. Oral medicine, prolog. Pedo, prolog. Perio, prolog. Ortho, you have to start with smart videos and worksheets because it's a tricky subject. OS, prolog. Cons, prolog. Endo, prolog. Community, you have to start with smart videos and worksheets. You need to read some basics. Everything moves around memory based, everything moves around concept. So in such a subject, this is my recommendation. For example, you are an offline student, you can start with offline paper. Because most of these boot camp series are offline papers or prolab papers, or an institute is discussing a particular Q bank or something, they regularly move around the PYQs. We don't give something which is unnecessary for the student. So we move around PYQs. So first mandatory thing to be done for any student who is preparing for entrance exam in the leftover days, who is restarting the preparation now, I strongly recommend to move around PYQs, revise them again and again, move around the PYQ concepts, revise them again and again. So that's going to give an extra edge in the examination hall to end up with a decent rank with a limited competition. Okay, right? So this is what the main thing I want to talk in today's video. Okay, right? Let's move around PYQs and start your preparation. Okay, you have a very good ample amount of time considering the exam in the month of March. If it is postponed in the month of April, you will be getting one more month added. If there are any things that are going to happen, unpredictability of the exam date, still few more days can be added. So those are accessory advantages. But even now, if you start your preparation, it is good that you can end up with a decent rank because you cannot predict what is the level of competition in your state if you belong to a particular state. You see, there are many states in the last 2 to 3 years where the competition has been dropped down. And there are many states where the competition has been increased. And you see in the last year, Telangana, the fees were increased. So unpredictability during the counseling. Most of the parents may not be ready to pay heavy fees. Or counseling of a deemed college can be unpredictable. Or we cannot predict the competition levels within your state. State level, we cannot predict the competition. You know, there is one state in India where a category student have got a government dental college clinical seat for 6,000 rank. I have never seen this. 6,000 rank category seat also I have never seen in my last 10 years of experience. But this has happened this year. There were states where the category seats were end up with 4,000. Unpredicted. Students also have not predicted it. And there were few students who are ahead of this 4,000, 6,000 have not applied for the counseling. Why not applied for the counseling? They thought they will not get a seat. So this unpredictability cannot be determined now. My point is very simple. First, go give your best in the leftover days that you have. If you are really interested in doing MDS, point is very, very clear. If your goal is to do MDS this year, or it can be next year, or it can be in the next 5 years, you don't want to do MDS, no need of giving this examination. Don't have any option. Like I see students going out, traveling with their batchmates to give examination. No point, not required. You can travel. No point of giving exam. If you're interested to do MDS, chalo, do it now itself. Because you have a good amount of time. Don't plan for 2027. 2027 is far ahead. Anything can happen in this 2027. Before you hit that 2027 March, February exam, anything can happen. We have lots of time, right? 1.5 years is there. Why are you talking about 2027 when 2026 is in front of you, and probability of getting a seat is still possible even if you start your preparation now. The next important thing I want to address is, if you are not clear about how you want to plan, because I see like there are few interns who are coming to offline center once they are done with their internship, want to have a vigorous reading, it's their choice. There are few interns who has taken off from the college, sitting at home, reading vigorously, reading seriously. The people who have shut down the clinics, reading seriously. There are people who has left their children to their parents or to their in-laws and preparing seriously. There are different categories of individuals. So it's about your commitment. So my point is very, very clear. If you have time in front of you, if you can show me the time to me, I'll give you a schedule. I'll tell you what to be done, where this has to be done, that has to be done. I'll give you the plan of doing that refined concepts. I'll be there with you to help you, to talk with you, to teach you in the most simplest way, and to try to cover the maximum syllabus within a limited time. If you are ready to work hard, or if you have a mindset to work hard. So that is how our team will integrate with you to help you. Okay, so it's completely your choice. Okay, so preparation is completely your choice. You are ready to prepare, we will be an add-on to your preparation. If you are not having an intention to prepare just to do chit chat and waste your time, so that's completely your choice. So this video is for all the students who have started the prep, who have taken breaks because of the college, because of their internship, or because of their XYZ commitments, who want to restart but don't have a proper plan to restart, clueless, not able to decide where to start, how to start, not able to conclude whether it's going to end up with a good rank or not. Is it really worthy to start now or worthy to start after finishing 2026, planning for 2027? If you have any such question marks in your head, it's a good opportunity. You can come back, you can talk with us, because we have some experience about the competition levels within your states, about the competition levels within your categories, about the fees, manipulations, all India quota, state quota. There are lots of things. Even that's what I'm telling. Like, we never predicted 6,000 student is going to end up with a GDC. It has done. It has been 4,000 unpredicted. So there are things which are going to happen. So it's a good time to take a good call and restart your preparation. So that's all from my side. Okay. So Andhra interns gani, Telangana interns gani, any sort of interns, like let it be a Maharashtra intern or let it be from any place, you need a support, mental support. You need you need a support and assistance in your preparation. We are open to help you, because you see, app-based preparation, they don't come out to help you at all the levels, because they have some restrictions. But here, our team, all the team members, all the core part of the team is completely dedicated to MDS Conquer from the last 10 years. So we know what is the frequency of a student, what a student can do, how far they can reach, what is their ideology in this leftover time. So keeping those things in mind, we'll come and help you out. That's what I'm telling, like Telangana interns, Andhra interns, let it be any state interns, you have language phobia or you have any sort of phobia, don't hesitate. There's nothing to hide here. Call cheyandi, because we have Karan who can talk multiple languages. He can talk Gujarati, he can talk Hindi, he can talk Telugu, he can talk Malayalam. We can handle majority of the languages. Pratisha or me or anyone of the team, or if you are not comfortable with English or if you are not comfortable with your speech, nothing to hesitate. Because I was talking to a few of you, they're phobic. The students were phobic because they were not able to communicate. First of all, you have a phobia to talk with mentor. Second one is you have a communication gap to talk. No problem. We will sit in front of you. We'll hear whatever you're telling. We'll try to help you. The ultimate goal is to help you. Main motto ఏంటంటే మేము మీకు help చేయాలి. We want to help you guys. We'll be with you. We'll be helping you. We'll be taking your responsibility, your preparation responsibility. We will be handling for the next couple of days, and it is our responsibility to guide you to a right department in the limited time. This is my primary motto. Okay, and now the ball is in your court to take this opportunity, and I'll make sure I'll tell the team to forward this video to each and every one of you who are part of MDS Conquer, who joined MDS Conquer. Hopefully you will be seeing this video. Take our help, take the team help, restart your preparation. Let's work hard together to end up with a decent rank. Even if you're planning to prepare for 2026 examination, it's okay. There's nothing wrong. You end up with a good rank in 2026. That's going to give you a good encouragement to hit back again in 2027. I see like people, not possible, college events are there, college fest is there. These are all temporary. You're losing something which is really important and something which is permanent for a temporary things. I'm not telling college fest or college events are not important. They are also important. But rather than this, you have many things which are more important ahead of you. Okay, even if you are planning to prepare for 2026, nothing wrong in giving a good attempt in 2026, because it's going to give you hope. It's going to open your doors. It's going to encourage. It's going to give you a good encouragement for you. It's going to improve your confidence. So that's all from my side for today. Okay, so if you have anything, maybe 1 or 2 days, I'll be fine perfectly to attend your calls and to talk with you on phone individually to give you some schedules and updates. Okay, right? So people who are starting now, make sure you start with whatever checklist I have given. First, you start with that particular checklist. Like, for example, Pro Life student, start with Pro Life paper, finish bootcamp series, attend the TND. This is mandatory thing, must do thing for solving the PY. So offline student, offline papers, bootcamp series, test and discussion. Apart from this, you want to do anything, do it. For example, like I feel like I'm watching a video. For example, I feel like I'm not so confident in radiation physics. I'll be going and doing that smart video of radiation physics. Radiation biology, I'll be doing individually. If I feel like I'm not okay with that, I'll be going and doing. If you have time and if you are decently a good student at a UG level, yeah, you can do anything. Anything is possible. Sit, you can use your time. But if you don't fall in this category, not able to finish the syllabus fast, you took a break of 3 or 4 years and trying to bounce back, I recommend you to start with Pro Life. You take this suggestion from the mentor. You directly ping me. I'll tell you what to be done. What to be done first. Simple as you have a buffet. I'll tell you what to eat. First, eat this, eat that, eat that. Once you're done with this, come back and tell me, sir, still My stomach is feeling hungry. I want to eat more. I'll tell you what to be done in the level 2. I'll be telling what to be done in the level 3. Don't randomly go with the systemic method of approach. Chalo, first I want to eat this, first I want to eat. No, you may fall short of few MCQs, which are easy MCQs. So first eat something which is easy. First do something which is easy. First do something which is very frequently asked. First do something which is going to improve your scores. The ultimate goal is to improve your scores and end up with a good rank. It's not about completing the syllabus. It's not about understanding the concepts also. This is a true thing, right? Over a period of 10 years, what I can tell is concepts are not important. Marks are only important when you're talking about MDS entrance, NEET MDS entrance, exam like exam. We are least bothered about concepts. We are least bothered about anything. We are more bothered about scorings, PYQs, and your rank, because those are the things which are effectively going to end up with a good rank. Okay, guys, make sure you subscribe the channel and keep your bell notification on, because we will be coming with few more important updates every 2 to 3 days. And we have planned for a quick fast mode of revision for Kerala PSC as well as for the INICET November 9th examination. So every 2 or 3 days we'll be having a half an hour live session, and the notification will be dropped. And that's what I'm telling you. If you keep your notification on and subscribe the channel, you will be getting the notification, so that uh, you can get that quick revision wala stuff, which is very, very important for the examinations. Okay. As of now, signing off, Dr. Shrikant from Team MDS CONQUER. Bye. Take care.